So for the first thing, this is something I've been preaching for like ever now, but I think right now when everyone's a little scared and the positive cases are rising on a daily basis and, things are kind of a little bit scarier than they have been in the past couple months because of our second wave, I think this is a great time to remind people that as much as we're doing and we're practicing the social distancing and we're wearing our cloth masks or whatever masks we have at the moment, and trying to stay at home and quarantine and do all that, jazz that has been kind of pushed out there, I think it's just as important to focus on your immunity. It's just as important to give your body the tools that it needs to fight this virus off. So there are a lot of people out there that are practicing all the rules, but they are still contracting the virus because, of course, all those rules are not exactly 100% effective. There's not like 100% guarantee that you will not get the virus. So the thing is, what people need to be focused on is if we get the virus, then what? If you are positive and you acquire the virus, what do you do then, right? Our best line of defense is our immune system. So if you do not focus on your lifestyle habits right now during a pandemic, then will you ever focus on it ever in your life? Are you ever going to really care about your health and your loved ones' health? Because this is the time to actually focus on it, because apparently it is life or death. You're supposed to prepare your terrain. Like if we were going to a war right now, right? Like during a war, you have two sides. You have weapons, you have tools that you need. Now, at the end of the day, when you go and fight against your enemy, if that spear came and killed you before you could fire the gun, it is what it is. You can't do anything. But at least you died fighting. You died trying. You died trying to get rid of it because you gave your body everything that it actually needed to try its very best. Right now, I don't think people have everything they need they're to the point where they've done everything, because their lifestyle habits are still the same. They're still doing the same when it comes down to their immunity, when it comes down to what they're putting in their bodies, what they're consuming, how they're sleeping, how they're breathing, how much exercise they're doing, what they're doing with their gut health, which is basically 90% of your immune system, what they're doing to take care of their microbiota and their microbiomes. The second thing I wanted to talk about was the PCR testing. So just wanted to talk about, if you, right now, since the cases are rising and so many people are positive, what does that exactly mean, right? So I want to push people to kind of do your research, figure out what PCR testing really is, polymerase chain reaction testing. What is that? How does it work and what does it mean? So when you get your results, you actually can understand your result better. You know what a positive is, you know what a negative is, false negative, false positive, whatever those really mean. And one of the main things that you should be asking your doctor if you are positive is, what is your CT number? What is the cycle threshold number? That is a very, very important factor when it comes down to PCR testing.
All right. There have been a number of reports of patients who shed viral RNA for weeks, as determined by PCR. It doesn't seem to be infectious virus. And the real question is, are they a threat for transmission? And I'm wondering if you think we could use a cutoff of viral loads determined by PCR to say this patient is no longer infectious, can go home, can go to a nursing facility. Because right now the physicians are really having a hard time with that.
Right. Again, a good question. And what is now sort of evolving into a bit of a standard, that if you get a cycle threshold of 35 or more, that the chances of it being replication competent are minuscule. So that if somebody, and we have patients, and it's very frustrating for the patients as well as for the physicians. Somebody comes in and they repeat their PCR and it's like 37 cycle threshold. But you almost never can culture virus from a 37 threshold cycle. So I think if somebody does come in with 37, 38, even 36, you got to say, it's just dead nucleotides, period.
Yeah, because as you know, we can't easily culture infectious virus. You don't have a BSL-3 lab everywhere.
Exactly.
Okay.
So is the threshold cycle is reporting out a pretty standard practice in doing a diagnosis now, rather than just positive or negative? Okay, good.
Yeah, I mean, if when you go in, when I get my test, it's negative. When someone comes in and it's positive, they don't give them the threshold until you go back and ask for it.
Okay, but they've got it.
They've got it.
Right.
They've got it.
Seems like there's a lot of variation in that, which is what I'm still researching on because I don't understand why there's a variation. There should be no variation when it comes down to the CT. But anyways, that is probably also messing up some of the testing results that we're getting and the number of cases we're actually getting that are supposedly positive. Anyways, higher than that specific threshold number, if it's like, let's say it's 35, and your CT was like 45 or 40 or 42 or something, it's saying scientific articles have said that that's essentially meaningless. That means they had to replicate your cell trillion billion times in order for them to actually detect anything. So, and that part becomes very important. Like, so for me as a human, I would want to know, like, am I infectious at this moment? If I got it, am I, how should I be handling this? How much amount of vitamin C should I be taking, or whatever else treatment what is my treatment plan? And that CT number can really help me, and not just help me, but it can help my healthcare provider. It can help the healthcare providers in the system right now that are dealing with the patients, and for them to know, should they discharge them or not? Should they keep them? Should they leave them? What is the best thing for them? And then if they get tested again, just to see if the CT level or the number increased or decreased, right? If it increased, then that shows you that, oh, this person is getting better. That means the virus is kind of disappearing, and something is helping it, or now it's coming out of their system, whatever the case may be, but so that, I feel like, or if it's the same, then I don't think they're ready to be discharged yet because they're still super sick and super infectious. So, that number really plays a big role in the PCR testing. So I do feel like it's our right to know that number, so we can do what we want with it and take action accordingly and move forward.